Okay. All right. This is White Coat Medicine Talks. We're back once again. Today we're going to talk about something a little orthopedic, I guess. You see a lot of patients that injure their knees, a lot of ACL injuries.
Actually, yeah.
Yeah.
A lot, actually.
Yeah. And a lot of...
They come in with canes, real nice looking canes. And they don't care about their knee. They look like my cane.
It's like the cane's good, yeah. Like the cane.
No, but yeah, there's a lot of that there's osteoarthritis, rheumatoid arthritis.
Yeah, now the bad thing is you worry about... like if an elderly comes in with an ACL tear compared to a young person with an ACL tear, what do you think?
I feel really bad for the young guy.
Okay.
I mean, literally, I think the nightmare of an orthopedic surgeon is to see a 17-year-old with a knee with a bad blown knee, because you go, God, I have to repair this, and they're probably going to have early arthritis.
They can, and especially if they don't repair it quick enough.
Exactly.
Because
sometimes they don't.
Yeah, and that knee's going to be shaking and moving and all that. Or somebody that doesn't have insurance and comes in with an ACL tear. Ay, Dios mío. That's bad.
That's bad.
Because that's when it really gets bad. Now, but the elderly guys, since they don't cut and play basketball and do all this other stuff, they can live with the ACL tear.
Yeah, I have a lot of them that probably have this really loose knee, but like you said, they're not moving.
They're moving forward, and
they're just moving forward, and they're turning.
Yeah, they're turning like soldiers.
Yeah, like shoulders, and they're not having to bend and so forth. But
so no surgery needed with those. Sometimes
exactly,
unless they're very very active guys.
Yeah,
which is okay, and I think a knee brace for those would be perfect.
Where do you usually see? What are they doing? What happens?
Well,
say skiing, because that's where some of these people get back. I went to
a lot of our basket. A lot of them are football. A lot of football injuries. I think that's the worst, and that's where you see most of those ACL tears. But a lot of falls, just falling on their knees. Sometimes, I mean, I've seen some people that are at work and they're falling and they do tear the ACL. Yeah, they do. Yeah, or they're jumping a fence and they come down the other side, hit their knees hard, and it kind of bends the wrong way, hyperextends, and then boom, it's gone.
Yeah.
And that happens, which is unfortunate. But you're going to see, I mean, most people will see a lot of swelling really, really fast. If your knee swells really fast, it's an ACL tear.
That's a good thing that Dr. Cruz is saying. The swelling, it could be pain, maybe no pain. Sometimes when you completely tear something, nothing more to move. Yeah. It's not going to be more pain anymore. It's just swollen. It's
swollen, and the swelling is the thing that will cause any pain, I guess, at that point. But then you just have to work through that. But yeah, ACL. But it's kind of like other tears. You get rotator cuff tears. I have some.
Have you ever done a test for the rotator cuff?
Yes, we do them all the time.
Do one for me right now.
Do one for you let's do for a supraspinatus muscle. So you're gonna put your thumb down, which is an empty can test. You're going to push down here, and that will be that muscle right back here.
So if I can't hold it up,
if you can't, if I push down and it hurts, or you can't even hold it up, that means you probably have a torn tendon there. Yeah. You also do your supraspinatus, infraspinatus by just testing. You can do it this way. You can put it right next to you, and I pull this way, and you hold it that way. If you can't do that, then that's a problem also with your rotator cuff. And it could just be a strain. It doesn't have to be a tear.
Well, you can do one straight out. Just you hold it just like you were saying, but not the empty can. I think it's a thumbs up test. That's what I call it. It's probably not a test, right? But
okay.
So basically, they're like this, just like you said, and just. It's another muscle.
And it goes right down.
Yeah. If you can't hold it down.
And then the other one that I do is I'll do the lift test, which is basically they're putting their hand behind them and they lift it off their back. And if they can't do that,
it hurts.
Yeah, if they can't do that, the muscle's torn as well. And those are all rotator cuff muscle exercise. I mean, tests that we do that then well, you have your supraspinatus, infraspinatus, teres minor, and the subscapularis. Yeah, so you have those.
Yeah.
So those are the ones that we test for.
Exactly.
But and it's important to take a look at them, and the only way to do it is MRI, really, so that the ortho can take a good look and say, yep,
so
we need to fix it.
Right. So let's say you see your patient and it looks like they need something. How hard are you going to be able to get that MRI? from our insurances.
Ay, Dios. Depends what insurance.
Right.
Depends what insurance.
Medicare, it might be easier, or Medicaid.
Maybe. But usually they're pretty good. With acute injuries, I think we can get those MRIs done. Yeah. You know, there's ways to get things done. The reason that people don't get them done sometimes is that they're claustrophobic.
That's a good point.
And they're claustrophobic and they don't want to get in the machine, and so then that's an issue.
Well, again, I think maybe a CAT scan could work.
Yeah, something could work.
May not be enough.
May not be enough for the doctor to go, let's do surgery.
Exactly.
Because or they can go in there and take a look and say if it's torn, then we'll fix it and do that type of stuff.
I have a good question for you.
Mm-hmm.
Of all these injuries from an orthopedic standpoint, what injury have you seen, because I already know which one mine is, where you've seen the most painful orthopedic injury? What was it?
Most painful orthopedic?
Yeah, part of the body.
Part of the body. Well, that's interesting. I mean, if you're talking, not fracture. I mean, we're talking fractures are okay. They're not so painful sometimes.
Just an injury where you go like, God, I have never seen an injury. Like, let's say you were talking about the knees earlier. Mm-hmm. For me, it's a shoulder. I've seen like a young, super strong guy with the shoulder dangling and the guy crying literally because he says that's just unbelievable pain because of the pulling. You know, the pulling. No matter what you do, it's pulling down. You lie down. It's pulling you, and you're trying to go to sleep. It's hard to go to sleep.
I had a boxer one time throw a punch and dislocated it, so we took him to the back and just put it back in. Wow! But he didn't seem to be in that much pain. I think maybe because he was beat up, and maybe there was other pain that he was feeling, and adrenaline and stuff like that. But once we got it back in, he was fine, and we just put him in a sling, and that was good. But yeah, the shoulder injuries can be really bad. But chronic things like tendinitis, like the Crevaine's tendonitis, it's painful stuff.
That I saw recently.
Yeah, I told my patients, man, I had that at one point.
Oh, you did?
Yeah, I did, and I had to make a splint. I made myself a splint.
Thumb spica?
Thumb spica splint. I wore it for about 2 weeks. It didn't work for me.
Okay.
And I was like, oh, it's too much pain. I said, let me just go. I told my wife, I'll be back. So I went, injected myself so that I could do the treatment for it with the steroids and all that. Oh man, that was such a relief.
Felt the relief.
And it got better all of a sudden. And I felt great.
Don't try that at home. No injecting yourself.
No, don't do that.
But yeah, I think you're right. I think this is one of the most acute, because I had one the other day, and it's treating it more than one time. And
I think the ones to treat when they get their tendon torn here. What is nursemaids fracture, whatever it's called, whatever.
Or you're talking about a trigger finger?
No, not trigger finger. Yeah, when they actually tear their tendon. And they get like a little mallet finger there, and so basically it.
Put a little.
And you put the little stem, but
it doesn't hurt, but you look at it and go.
It's easy treatment. Is that you keep it, up like that, but you have to keep it on for 6 weeks. And most people, after 2 weeks, they look at it and it's like,
you just ruined that.
You ruined 2 weeks, man. It's like you got to start again. It's like you ruined 2 weeks of treatment. You got to put it on for 6 more weeks. It's and they always tend to do that, man. No matter how much you tell people, don't take it off.
It's just a curiosity.
It is, man. And it's like they just want to take it off, and it's like, don't do it.
It's a real, like, I think when somebody pokes playing sports and they accidentally hit you. And,
So I always tell my kids, I said, if you're gonna open a door coming out of the bathroom, you bend your fingers before you. Because if not, you're going to do this. Somebody's going to open it, and you're going to
have that fracture.
Yeah, and you'll have that tendon tear, and it's like, no, you don't want to. So I always bend my fingers before I even put it close to the door. Just things.
Something to remember.
Yeah, I'm just like that. It's just things, man. But anyway, all right, man.
Sounds good, man.
Well, this is White Coat Medicine Talks.
Nice talking to you guys. We'll come back with something else.
All right, take care, guys.
Take care.